just tell them, I said, we put ourselves in this situation. You want to be a doctor, and I was here to support you. So we can either whine about it or we can suck it up and get it done.
Suck it up, buttercup.
Yeah,
that's her favorite.
And my friends would always joke, and they're like, how can you have that attitude? And I'm like, we're all lucky to be in this position. They're lucky to have their jobs. They're lucky to do what they love. So this is not forever. This is 6 years. And then
we are so excited to have special guest Dr. Nick Walker and his wife Nikki Walker. They have a family-owned practice that just opened here in Frisco, Texas, and they've done a lot of things organically as they are a family-owned business. So I want to welcome you guys to the show.
Thanks for having us.
Thanks for having us.
So first off, just tell a little bit about how you got started and how you decided, why you got started, because you guys came out of state here to Dallas and just started everything up. So talk to us about that.
Yeah, I mean, it really came full circle. We were from Louisiana originally and really loved Texas. I visited here my entire life. And then Nikki's parents about a decade ago moved here for business. So we got to know the Frisco area and kind of North Dallas suburb area in particular, and just fell in love with it. The people are so nice. It's kind of a diverse population and people from all over. A lot of the same core values. And a year and a half ago, I was finishing up residency in Wake Forest in North Carolina. We kind of had to figure out what we wanted to do with our lives, because every step along the way up until then, you went to college and you went to med school, and then it was like, well, now this is kind of what we've worked for. What do we want to do? So we made the decision to live in Frisco because Nikki's parents were here and my parents are close. So I interviewed at a lot of practices here, and then, all the people were really nice that I interviewed with, but eventually it just came down to I could be a junior partner and work my butt off and then eventually pay a ton of money to be somebody else's employee and maybe an equal partner one day. Or we could just kind of make the investment ourselves and take the leap. And one night we just kind of looked at each other and knew that was the right decision. It was about a year and a half ago. And then ever since then, it's been trying not to make big mistakes, just the small mistakes along the way, and really do our research.
Oh my gosh. Well, congratulations, because that's not an easy process. So good for you guys. That's amazing. Let me ask this question, just because of me working at Henry Schein, and I see a lot of dentists who they put all their time and their energy and their brain is all on like the clinical side, right? And
yeah.
I mean, you guys went through years and years and years of school. Like, if I could have a chunk of your brain, I'd be happy, right? But then they start a business and you don't get a whole lot of schooling on that. And correct me if I'm wrong there. So what was that process like, of kind of that unknown?
It was a little scary, and you're right, we get zero business training. And we were kind of lucky early enough to decide that we wanted to do it and really start planning ahead. Nikki as well had, a business background. She trained in accounting. She was able to be a CPA for a big firm for a couple of years.
Wonderful.
And really helped put me through med school, and then decided to be a stay-at-home mom from then. But I always still kind of wanted to get back into something.
Yeah.
So when we decided to do this, I mean, you walked up to me and said, "Hey, do you want to save $100,000 a year?" Because I'm in the market again. And
I love that.
We knew we'd be able to work together, and I knew I could trust her, obviously.
Yeah.
Clearly.
So, like you said, kind of yeah. And if I can, I have more problems to worry about than just business. But
so was it more so, Nikki, you were really the catalyst and like, I believe in you, we can save 100,000? It sounds like it was more you, but tell me about that.
It was a big mixture, because I would see him interview and I could he's always said he wanted to own his own practice. That was his dream from the get-go. And I could just see him getting not frustrated at the interviews, but I just knew he wasn't getting what he wanted. So we just sat down and we were like, well, we could move cities and pick a different city where we want to live, or we can just go for it. And he was like, if you want to go for it, I'll go for it.
There's no question.
Yeah.
She had the magic wand to push me one way or the other. There's no question.
Yeah.
And I think that goes with anybody who's in a good relationship. You kind of lean on that person, and she believed in me, and even, like I said, put the support. So so far so good with that, but it's been a process. I mean, we've struggled along the way, even up until now, and we're just getting started. But
there's definitely been like bad days, and on my bad days where I'm like, this is so frustrating. He's like, no, we're gonna do it, and then vice versa.
Yeah.
So.
And you guys have kids, so
Yes.
it's like new business, kids, new move.
Okay,
It's
how
just
are you
everything.
doing all of that?
Y'all
just
look
take a
great, by the
pause
way.
for 1 second. Like,
We like to
You
do
too.
everything at once, you know, just throw it all in there and get it all over with. So we have a lot of support, We definitely couldn't have done this without our families, because they've been there to watch our kids while we needed to run to the office. And so.
But to kind of better answer your question, you know, a year and a half ago, we decided we wanted to do this. Nikki's had some accounting and business training, thank God, but I had zero.
Yeah.
So we said, you know, how do we do this? So I approached, Wake Forest has a big network of people who've been successful in practice. So I approached all of them and said, point me from point A to point B. What is everything you did? What's everything I should do? And what's everything I shouldn't do? And then at the same time, we reached out to a lot of plastic surgeons that I'd worked with, and Nikki reached out to their business managers and did some internships with them and said, hey, you want some free work? I'm available. I'm gonna come, you know, learn as much and be a
I didn't know
sponge.
that.
Over time, we just developed a business plan and implemented it. And like I said, it's the whole theme has been, let's make small mistakes and not you know, miss out on big stuff. And I mean, we've even had instances. One piece of advice that I'm still learning is just to be really thorough on anything you're signing your signature on.
yes.
And we've had people who have literally put stuff in the underwriting that would have really been negative for our business the first year out. And we caught little things and we're like, hey, what about this? And they're like, oh yeah, like that says you're going to give us 15% of your money for the entire first year of your practice. We mentioned that, right?
Oh,
so, you know,
my gosh.
I mean, little stuff like that. And I know you being a financial planner, you know, like little mistakes like that. I mean, it could just ruin you first.
Huge.
Yeah, I just can't believe they don't give them one single course. And I mean, some med schools do, but you didn't have a single
That
course.
blows my mind.
Business.
And we've talked about that with me putting together some kind of loose curriculum for the upcoming residents.
Yes.
You know, so what do you do if you want to start a practice?
Yeah, like what is step one? Because a lot of doctors don't even know.
Yeah.
What is step one? How do I
Absolutely.
even
That's a great idea. And I'm sure there's a lot of people who would be interested in something like that. And you'd be helping a ton of people from some of those mistakes that either, you know, you've already made or you were about to make, and then we're like, holy crap, hang on, back up here for a second. So let's talk, if you don't mind, switching gears just a little bit. Let's talk about like what you guys are actually doing and just about like plastic surgery in general. I know Tina had a couple different questions about it, but I mean, give me like the rundown on it. Mostly right now with COVID going on, like are people not wanting to spend their money on that? How are you combating that? Like just talk to me about all the things with your actual profession.
Yeah, I mean, I think number one, you have to make sure everybody's safe. So we've implemented all the CDC and AMA and Texas Medical Board protocols. We make sure people are wearing masks, that they're walking through the door and filling out, you know, the protocols to make sure they've not had any symptoms. And we're also protecting our staff and implementing all those, because worst case scenario would be to do something that you're bringing somebody in for an elective procedure that's not to fix a life-threatening illness and you make them sick.
Right.
And
Yep. I didn't think about it like that, but yeah.
Easy things to do. And then the second somebody walks through the door, you know, we have a lot of systems in place to kind of let them know everything that we're doing. And for me as a plastic surgeon from Wake Forest, we had a really high case volume. So I was lucky enough to get comfortable with a lot of cosmetic and a lot of reconstructive procedures. And our clinic offers, you know, everything from literally head to toe. My personal interest is rhinoplasty, nose jobs, but I do a lot. I think Tina and I have joked a lot. I actually had a pretty high volume of Asian blepharoplasties, which is a specialized type of blepharoplasty, which is an eyelid surgery. And then facial aesthetics, mommy makeovers, which means, you know, kind of tightening and getting everything back to where it was pre-pregnancy. And those patients are really, to me, really rewarding to take care of, because it's somebody who's like, you know, I felt really good about myself, and then I went through this sacrifice of having a child, or I had some kind of injury, or some patients who I had cancer and had it removed, and now I don't feel like me anymore. And then you get to kind of get them to feel whole again, and it's super rewarding. And then
that's actually like one of my big fears. I'm like, what if my husband doesn't love me after all of this goes away? You know?
Yeah,
because I'm not having kids young, you know, I'm still 34, I'm single, right? So like by the time I have kids, I'll be like 30 late, and I don't think it bounces back. So that is kind of one of my big fears. Is it actually really possible to get it back, like back, or back better? Actually, I want it better.
Back better.
Everybody's individual, and each situation's different. You know, you have women that come in and they've fared better for whatever reason. They have better genetics, or they were in better shape, or they took better care of their skin, or they had more or less kids, breastfed. And then you have, you know, you have patients that you get back to a point where they feel good, but they'll never, no matter what amount of surgery, get back to the shape they were in without at least additional scars. Some women are okay with that. Most women are, and some women end up saying, I look better than I looked before. I mean, I actually had a case last Monday, and she literally at her follow-up appointment said, when I looked in the mirror, I almost cried. Like, I never felt like I could look this good. And those are the people you're like, man, I really, you know, all the negative stigma of cosmetic surgery in the media and everything. I mean, those are the patients that let you know, like, if you pick the right patient and do a good job and take care of them, you really have helped somebody.
Yeah, and that actually brings the point of there's a lot of postpartum pregnancy depression, and I would think that if, you know, that would honestly help me, like just feeling good about myself would, you know, knock it out.
Yeah, and there's no question. There's been a lot of really well done published studies that shows not just physical but psychosocial benefits in a whole array of patients who have plastic surgery. So like I said, it's all about picking good patient selection, and not, I mean, you've seen like botched, not augmenting the patient who came in with already too large of breasts or some crazy image in their face, you know, and making sure that you're doing stuff that's appropriate. But at the same time, I mean, I feel like every patient that comes in the door that has, you know, generally has a really good experience and feels really good after.
Now I have two questions kind of based on what you said. So first question would be, have you had to turn away patients before, and what is that like? And the other thing is, do you kind of wish maybe while you were going to school you got a course in psychology? Like, is there a lot of psychology that goes into this, that like the conversations that you have and the reactions that you have and the whys behind why people do it? I mean, do you kind of wish you had a psychology course too?
Well, I was lucky enough to take some psychology, and we do
perfect.
rotations in medical school. But I feel like plastic surgery is and really most specialties, when you're dealing with so many different patients, especially patients who have had trauma and are not even in their best state of mind when you see them. It's almost like a psychiatry course in itself.
For sure.
You know, I've heard a lot of good surgeons say this, and I feel the same way. Like, you're not a good doctor if you're not telling somebody no at least once a day, because people come in with unrealistic expectations, or some people are not educated on the procedures they think are best for them. And it's our job to say, you know, this is not what's best for you. It's not safe. And a big reason why we end up saying no is because, you know, the patient has to be healthier to go under anesthesia.
Interesting.
losing weight or smoking cessation, or, an array of other interventions can be done to make it a lot safer. And what we try to do at our practice is offer them resources to make those changes, not just say, well, go lose weight and come back later. We are trying to implement some weight loss programs and resources for that, and establish relationships with some primary care physicians in the area and help them stop smoking, not just say, all right, go stop smoking, come back when you're better,
Yeah, just turn that light switch off real quick. No big deal.
Yeah,
that's amazing that you guys do that. I love that.
And also, sometimes it's just unrealistic expectations.
Yeah, the worst thing you can do.
Yeah.
Worst thing you can do is operate on somebody that will never be happy, because then you've made them pay money and you've put them at risk of surgery, and it's going to be for nothing.
Is there a time period you're like, this is too young, you're too young?
Well, it just depends. In general, for a cosmetic procedure that's truly cosmetic, you wait until they're not a minor anymore. But you have a subset of patients who have congenital deformities. A common population we see is patients with Poland syndrome who have agenesis of a portion of their breast. And that's something you don't always want to wait till they're 18 to fix, because that period from 14 to 18 is a really important sexual developmental period. And, not that they're necessarily sexually active, but they're kind of developing that person to themselves. Those are actually situations where the parents and the patient, and even sometimes a psychiatrist, is really helpful. And we could talk all day about that subject, but in general, you make sure that the risk of surgery and doing it young is going to outweigh the psychosocial distress they're undergoing at that age.
So this might be a controversial question. I know there's some other doctors that give good doctors a bad name. How would a patient go about that? Because I don't know if you know about some of the stuff that had gone on in Dallas, in not specific plastic surgery, but just maybe bad doctors.
Dr.
I mean, I'm not naming names.
No,
how would a patient go about vetting, the doctor?
It can happen anywhere, and I think number one, going and seeing that doctor in person and really getting a gut feeling. I think it's probably always the best way, not necessarily going by what kind of reviews they have and what kind of Instagram presence they have. And number two, I don't know, I'm no specialist in the other medical specialties, but for plastic surgery, you want to make sure that they are a plastic surgeon, an actual plastic surgeon, not somebody who trained in any other specialty and does some plastic surgery on the side. Because little known fact, you're kind of allowed to do that to an extent. There's plenty of people that are cosmetic surgeons and they trained in other specialties besides plastic surgery.
Oh, I heard a dentist.
Cosmetic surgeons.
Like a plastic surgeon.
What's that?
There's a really known dentist that is a plastic surgeon now.
Yeah. And there's some specialties that are well trained in aspects of plastic surgery that are totally appropriate. There's ENT doctors who do plastics fellowships. There are oral surgeons, like dentists, who go to a bunch of additional training and residency that do some facial aesthetics. That's totally appropriate.
Oh, okay.
In my mind, as a biased opinion, I think plastic surgeons get the best training overall.
Well, yeah,
because it's focused.
I wouldn't have done this specialty if I didn't think that. And the best way to know that you're seeing somebody who's legitimate is to make sure that they are board eligible or board certified by the American Board of Plastic Surgery. I'm board eligible. I'm actively taking all my written and oral boards. I'm trying to be recognized as a legitimate entity. And you won't find that in somebody who, went out and did a family medicine residency and then decided to do a specialty they're not trained in, like plastic surgery, and they just slap the cosmetic surgery, label on their practice, and now they do Botox and they do a bunch of stuff that, if there's a complication they're really not trained and it's really not safe for them to do it.
So
Yeah.
switching gears a little bit, we had quite a bit of questions messaged to us on our Instagram about, and this question is a little bit more geared toward Nikki.
Yeah.
It is so. Yeah. So as the time I've known you guys have really a great dynamic. You're almost like each other's biggest fan. Like, Nick talks very highly of you, Nikki. Like, he's like, Nikki's the one who knows that stuff like the back of her hand, and you're like, Nick is awesome at this. And I love that one about y'all's relationship and the support there. But tell us about how you balance like being a lot of hats, right? You do the stuff for the office, you're a mom, you're a loving wife, you look great, you're in good shape. Like, there's a lot.
Yeah, like what?
No.
I don't know. I really don't know. We just do it, and you just get up and do it. And I mean, he knows that. The other day I had like a day and I was so frustrated, and he was there and he's like, what can I take away from you? Like, how can I make it better? But I don't know. We've both been so driven our whole entire lives, and we just are go-getters, and we want to get it done, and we want the next thing, and we're like hungry for more. And not so much like success and money, we're goal-setting people. Like, this is my goal for the day, and I'm gonna get it done. And if I don't, I kind of am like, well, I could have gotten that done, but I sat around instead. So I don't know.
I think
That's
we are.
just our personalities.
Yeah, I mean, we're both type A people and huge goal setters. And I mean, I always end my day, and if I didn't achieve the goals we've set, and I'm kind of a little disappointed. And I wish sometimes I was less like that.
Yeah, I do have to reel him in every now and then and say, can you sit down and relax for 5 minutes? And he does, but.
It's all, I mean, it's easy when like, you know, one of us is not like super neat and one of us is like super neat, you know, and Nick's like really good about exercising. So I'm like, all right, I guess I'm gonna exercise too. Like, I'm not gonna let her, you know, work out 5 days a week or whatever and sit on the couch and be lazy. So it's a good give and take, I think.
Yeah, I think the reason we can do it all is because I know I can pass something off when I need to, and I'm not overwhelmed. I know, and I also know a line like, hey, I am overwhelmed and I need to give it away. That was a very hard thing to learn when I became a mom. Like, I think I had this, you know, like, I need to have everything done and I need to do it all. And I eventually learned I can't do it all, and I need to ask for help when I need help. So that is a good takeaway from that. I can't do it all.
Yeah, and we're totally spoiled. We have a really strong family support system on both sides. I mean, my mom literally flew here our first week of business a couple weeks ago, and watched the kids the whole week. I don't even think I saw them the whole week because we just work.
Oh my gosh!
Way busier than anticipated, so it was good. And then Nikki's parents live in town, and at the drop of a hat, you know, watch the kids, and I think that's important, and we're blessed for that.
Well, and I love the fact that you guys use that support system, right? I think so often people have people around them, they have relationships, they have friendships, they have family members that want to be there for them, but people have like this ego or pride where they don't ask for it. So I love the fact that you guys are using your support system, and I can tell you guys are the type of people where if they needed it, you guys would be there in a heartbeat too. Okay. So that's amazing. Really good advice there.
People see it as a sign of weakness when you ask for help, but I think it's the exact opposite, you know? So
totally.
That's funny that you say that. I was watching some like dating something, you know, and it was talking about, yes, you can do everything yourself, but if you can get a man to do it for you, that's but right. But my other question was, walk us kind of through, how are you, because Nick literally gave you credit. He's like, Nikki put me through school. What is that like when he's, you know, going through that? And did you feel alone, or is it very similar where you're like, hey, I need you to pay attention to me right now? Like, walk us through that.
Med school honestly was not, I mean, med school was bad, don't get me wrong, but it was not that bad. And I was working for most of it, and I'd have busy season with accounting, so I was just as busy as he was at some points. I guess that's why I didn't notice it as much.
I honestly felt like I was less busy than her sometimes. I mean, in all honesty, I was like cleaning the house and doing the laundry, like, wonder when Nikki's gonna be home.
Yeah, so, right? Yeah. So then we moved for residency, and that's when we got pregnant with our first child. Speaking of, we like to do everything at once. We moved across country. I was pregnant and had a baby, and he started residency, and that was overwhelming. But, you know, I made a ton of friends out there. And again, it was the same thing. If I needed help, I could ask for help. And we'd have days where he'd come home and he'd be tired. And I'd just tell him, I said, we put ourselves in this situation. You want to be a doctor, and, you know, I was here to support you. So we can either whine about it or we can suck it up and get it done.
Suck it up, buttercup.
Yeah,
That's her favorite.
And my friends would always joke, and they're like, how can you like have that attitude? And I'm like, we're all lucky to be in this position. They're lucky to have their jobs. They're lucky to do what they love. So this is not forever. This is 6 years, and then we'll be done.
Nikki had such, you know, I have a lot of friends who are in different medical specialties, plastics, and a kind of across the board. And a lot of what I saw was partners giving the residents a tough time, you know, both male and female, a tough time for spending so much time in their training. At the end of the day, we're like, hey, we made this decision together. Nobody put a gun to our head and made us move here and go to residency. And, you know, and it could be a male or female saying this to their spouse, like, if you want to be married to a plastic surgeon, you got to pay the price too. You know, it's a two-way street.
It's a full-time job.
I mean, it definitely affects the spouse, you know, in whatever specialty you're training in.
Yeah, and he didn't ever want to be stuck at the hospital all night, and he didn't want to miss, you know, kids' birth. Well, he never missed birth. But you didn't want to miss like school functions and things like that. But I mean, you had to. You can't just say, "Oh, well, move that surgery to later." Your attendings would be like, "No way! Get your butt into the OR right now." So you just suck it up and you do it. And I knew there was an end in sight, and I think that's what matters, is knowing that it's not forever, that it's going to be at the hospital all weekend. So, and you're not. You're home on a Friday afternoon.
Yeah, I mean, we're taking the kids to the pool this afternoon. So
yeah.
I love it. And I like how you called it a season, that it's a season of your life right now. And so it's like, okay, let's get through this one. Let's be a team. Yep. And then we'll, you know, enter into the next one. That's great. So it's funny. My parents, they always use this term where they're like one crazy person at a time. Like you both can't be like angry at the same time or stressed at the same time, because you have to be able to rely on that partner. And I feel like you guys are like perfect with that, where it's like, okay, maybe if Nick is having a really stressful time, Nikki's like, come on, like we got this, let's do it. So I feel like you guys have that really good balance, which is super, super difficult to find. So I love hearing your story about how you're able to do that together.
Definitely try not to be crazy at the same time.
Yeah. My mom's going to be like, why did you say that? But it's true. I mean, it's a good, it's a good saying, right? Only one crazy person at a time.
Totally good. And it makes sense.
So I want to wrap up with some of the things that Anna and I heard you guys say today, and all the things that we took away. You guys said, you know, let's make the small mistakes. There's no big ones right now, right? You guys also said, just be aware of the things for the maybe surgeons or anybody opening their own business. Be aware of the things you're putting your signature to, and read the fine print. Also, you guys said, do your research, go meet your doctor, make sure they're board certified, board eligible. And then I think just from a personal standpoint, or just any type of relationship, just making sure you have good support and give credit to those that deserve the credit, right, for supporting. And then being self-aware of when you need help and asking for it, I think is just like can hold true in any aspect of life that you gave us, Nikki, today. And then the famous tagline is "Suck it up, buttercup," but I'm gonna give that credit to Nikki. And so,
yeah, go ahead.
No, I didn't have anything else to say.
I think a huge lesson for me, and we didn't even know we were doing it at the time, is just to build really good relationships with every aspect you need for your business, and to just to find the right person. Like we use Sean as one of our outfitters, and just as a shout out, and you know, finding the right reps and people that are going to actually return your phone calls when you need it and kind of talk you down, and eventually you end up with this huge team of people you didn't really know were going to be so important for your own business. And keeping those emails and relationships and just using your gut, I think, is really important in business.
And I would say also never think someone is not worth your time.
Yeah.
Because you may not think they're worth your time right now, and they may not be exactly what you need at this moment, but 5 months, 5 years down the line, you may say, hey, I need to talk to that person. If you were rude to them, they may not want to give you the time of day. So
Yeah, absolutely.
Flashbacks to high school. Just kidding.
And there's, like you said, with your business, and I've realized this now being in dental and working with different dentists, there are so many different aspects of it, right? And it's impossible to be an expert in all of them. And so finding people in each of those categories who can be a mentor, who can be a support for you is huge. And to Nikki's point, don't ever think that, you know, you're too good for someone or X, Y, and Z, whatever it is, because you never know when that person is going to be helpful for you in your network or vice versa. So
Right.
That's great. But how the heck do we find out more information on you guys and your website? We gave you the opportunity to share your screen. So we'd love for you guys to either pull up your website or wherever we can find out more information on you and contact you.
Yeah, Dr. Nick Walker is our Instagram. We're starting to really ramp up and post some fun stuff. So we'd love for y'all to kind of take advantage of that and start kind of learning what we do and how we can take care of you if you need it. And let's see, are y'all seeing what I'm seeing?
Yeah, we are.
Perfect.
So
this
it would
is our
go.
website. Nikki actually designed this website, so she's really proud
Oh,
of it.
of course she did. I need a Nikki in my life.
I know.
Yeah,
Can I have
exactly.
one?
So
You have little ones though.
it's nickwalkermd.com, and you know, kind of searching through here, we tried to make it really easy, and you just scroll through here and kind of see everything we offer.
It looks really good.
Invasive and true surgery procedures, from facial aesthetics to facial fat grafting, ear surgery, and then breast surgery of any type, mommy makeovers, tummy tucks, and we offer a lot of non-surgical options as well. We have a fantastic staff that we're lucky enough to acquire, and one of them is Dewena Acosta, who is absolutely fantastic, and she's been part of the plastics and dermatology specialties for over 20 years, and she's got a huge injection following. And I was known as the person who all the nurses came to for their injections at Wake Forest, and I'm learning a lot of stuff from her. So she's a fantastic
Yeah, she's amazing.
asset, and we do a lot of in-office procedures, chemical peels, Botox fillers, hair restoration with PRP, platelet-rich plasma, all the vampire facials. We do, I do blepharoplasties and eyelid surgery and upper lip lifts in the practice under local anesthesia. Patients tolerate it really well, and
So
we've had
it's
some
all
really
in-house.
good result. Yeah, a good amount is in-house, and then all the surgeries we do are at a really nice surgery center that is a really intimate setting that is 10 minutes from the office. You don't have to sit in a big lobby full of people. And it's Preston Surgery Center. And they, have been really welcoming and giving me, predictable block time and taking really good care of my patients. So we're lucky to have them as well.
Yeah.
So we'd love to take care of anybody who's interested or just wants more information. We do free consults, and we're starting to fill up, but still have a lot of room for people, and could not be happier to be in the Frisco area and to be taking care of people. And I don't take it for granted, one person that puts their trust in us. And thank you guys as well for having us today. It's a pleasure.
Oh, no, thank you guys for coming on. And we're so happy that you guys are in Frisco too. You made it over to Texas, and now you get to take care of us. So it was so great to meet you.
We'll do a grand opening, and you guys can all come and
Yeah,
stuff.
we'll let you know, Tino, and make it a really fun event and try to promote it a bunch and just tell everybody how thankful we are for the warm welcome.
Yes. So, I mean, that is honestly my favorite part about when I'm working with medical professionals, just their genuine heart to just do what they do for the goodness of others. And that's one of the big reasons why we invited you guys on the show today, as well as y'all's dynamic as just a partner in life, a partner in business, and just each other's biggest fan. I admire that. That's one of my couple goals. And Anna and I just want to say thank you so much for joining us today. And then thank you so much. Bye, guys.
Yeah, enjoy your pool day with your kiddos, okay? Bye.
Bye.
Thanks, guys.